Hi, we're going to be going over visceral diagnosis, week 2 right now. We'll be doing the head and neck exam for lab. So we start out with doing an inspection. So when we inspect, we're going to look at hair, and we look at the color and the distribution. And then we look at next the scalp surface, and this is where you can actually look in and look at the scalp. One time you can touch during the inspection exam, and you look at the scalp surface. And then we're going to look at the head, and we look at head position, tilt, and any rotation. And then we look at the skull for its shape, size, and symmetry. Next we look at, and also we look at for condition, like for the skull's condition. And we look for the face, we look for shape, symmetry, and any structural abnormalities. Oh yeah. Oh. And then next we look for any battle signs, which would be, go ahead and turn your head here. It'll show up on the mastoid, and this is again where you can touch during the inspection exam. It'll be bruising of the mastoid, and that's the battle sign. We'll next look for de Musset's, and she doesn't have de Musset's, which would be a bobbing of the head and coordination with her pulse. We'll next look at the neck. Neck, you're looking at symmetry of muscles. You're looking for any webbing and any masses or edema. And masses or edema would be probably in here near the trachea. We'll look at the tracheal position next. And go ahead and swallow for me, please. So you have the patient swallow. And you look for, again on the neck, you look for any distension in the veins or arteries. And look for skin color variation. And we'll next go through ranges of motion. So go ahead and look up as far as you can for me. And now tuck your chin all the way to your chin as far as you can go. Alright, now go ahead and sit up and turn your head all the way to the right as far as you can go. And all the way to the left as far as it will go. Alright, now set like center. And laterally flex your head to this side to your shoulder as far as you can. And to the other side as far as you can. Alright, now we'll do palpation. So we're looking for hair and texture. So you feel the hair for texture. And we check the scalp to make sure that it's freely movable. Short circular motions here. Skull, you're looking for symmetry and condition. So you're feeling through the whole skull. Alright, now we'll palpate the temporal arteries. You're going to be very gentle with these. So you can feel for like the temporal pulse. And then once you have that, then you can palpate here. And you want to make sure that there isn't any thickening or hardness. Alright, next we're going to palpate the hyoid bone. And that's at the level of C3. And then you go to the thyroid cartilage, which is C4 and 5. And then to the cricoid cartilage, which is C6. And then you palpate the thyroid. And what you're going to do is you're going to take the thyroid where you had the thyroid cartilage before, and you're going to push it just to the side here. And then you're going to go through and feel the opposite side. And do the same thing on the other side. Push it over, and feel this side. Alright, and now we're going to have the patient go ahead and swallow. Okay, and we're looking for tracheal tug. So take 2 fingers, put it above the episternal notch, and you're feeling for tracheal tug. Alright, now palpate for lymph nodes. So with this you can go ahead and start in the occipital. So palpating for occipital lymph nodes. And you'll go ahead and do post-auricular, which is behind the ear, going up to the pre-auricular, down the front of the ear, coming out along the facial, and hit the facial lymph nodes. Relax your facial in here. Going back now to the tonsillar lymph nodes, submandibular, submental. Now go ahead and you're going to turn your head to the left here and flex forward, like laterally flex a little bit. Pop out the SCM, and we're going to go down the anterior cervical chain. Go ahead and do that on the other side just so we don't forget to do both sides. Anterior cervical chain. Go ahead and do the posterior cervical chain. Turn your head to the opposite side. We'll do the posterior cervical chain here. And then to the supraclavicular lymph nodes, which are here. And now we'll go into auscultation. And with auscultation, we're going to use the bell, and we're going to auscultate the temporal arteries here. So where you found the pulse, you're now going to come over here, and you're going to listen for a couple seconds. And you do it on the opposite side, and you're going to be auscultating for any bruits. And do the same thing now. Hold your breath, please. And you're listening on either side of the thyroid cartilage. Alright, and that completes the head and neck examination.